Hi there, my name is Francesca Barrett. I'm a mom who chose to breastfeed my baby for a variety of reasons. Along with other benefits, breast milk offers a perfect nutritional balance of protein, carbohydrates, fat, and other nutrients in forms a baby's digestive system can easily break down and process. That's why the American Academy of Pediatrics and other authorities recommend breast milk as the ideal food for your baby. Your breast milk comes in 3 phases. Colostrum, a thick yellowish fluid, is available before giving birth and will supply your baby's first nutrition. Your baby benefits right away from its easy-to-digest proteins, vitamins, and minerals, as well as from the protective antibodies it has. That's why it's referred to as liquid gold. It has more protein and less fat than the breast milk that will come later. Transitional milk usually appears 2 to 5 days after birth. It's whiter and creamier than colostrum. Mature milk typically appears 10 to 14 days after birth. It's thinner than transitional milk and can have a bluish tint to it. Despite its appearance, mature milk has all the nutrients needed to support your baby's growth and development. During each feeding, your breast will have periodic milk ejection reflexes, also known as the letdown reflex, where the volume of milk released increases. You will also notice at the end of each feeding that your breast milk gets thicker and creamier looking. This milk, sometimes called hind milk, is especially rich in good fat, which helps your baby feel full, satisfied, and sleepy. And who doesn't love a content sleeping baby? When I first started breastfeeding, it didn't go as smoothly as I would have hoped. Now I tell my friends it's a new learned skill for both mom and baby. Learning how to breastfeed comfortably is the result of patience, practice, and correct latch-on and positioning techniques. But once you learn the basics, it becomes easier and more natural than ever, and it's a wonderful way to bond with your baby. In addition to bonding, breastfeeding also offers you some important health benefits. Because breastfeeding burns calories, it may help us lose pregnancy weight more rapidly. Women who have breastfed also tend to have lower rates of ovarian and breast cancer. And some studies even suggest that breastfeeding may ultimately help increase bone mineral density, which could protect us against osteoporosis later in life. In fact, breastfeeding is so beneficial for moms and our babies that the American Academy of Pediatrics recommends continuing to breastfeed until at least baby's first birthday and beyond, as long as mom and baby wish to continue. Join me now as I share some breastfeeding tips with my friend and her newborn baby. You know, even though breastfeeding is a natural thing, positioning and latch-on techniques are learned skills. Remember, it takes many women patience and practice. So give it time.
Hi, my name is Josie Julo. I'm with the Northern Virginia Lactation Center located in Fairfax. And this is baby Mia, and we're going to work today on teaching her how to breastfeed in the football hold position. So what I'm going to do is to take her and have mom sit in a chair that gives good back support. And if you could reach over and grab me that pillow, we're going to take the pillow and turn it on the side so that the end of the pillow is touching the furniture in the back. This end, oops, sorry, honey, is coming, angling towards the mother's thigh. And this piece that's sticking out, I'm going to tuck right down and into the side of the pillow. So we have almost like a 45-degree ramp coming here. Typically, I would take and put a towel across because we'll be using the towel to help support the baby. Okay, Mia, let's do your stuff. So I'm going to take her, turn her chest to chest so that her body is pressed right into yours. And the web of your hand, which is located right here, is at the base of her skull. And we want to align her nose with where the nipple is. Now watch what she's doing already. She's starting to root and open her mouth, and she's going to actually, look how wide that gape is, okay? So let's just get a good support. This hand, you're going to hold or cup the breast, and sometimes I tell moms to think about karate chopping this side of your hand under your breast to support the breast tissue. the tip of your thumbnail right here touches at the base of the nipple. Now note that this is 12 and 6, but the direction that her nose is coming in is at about 1 o'clock position, and your bottom fingers are just supporting well off the areola. So go ahead and cup and hold your breast, and when we take and depress with your thumb, you point it back so that you can see the tip. See how it's pointing away? Okay, so what we're going to do here is you're going to hold the nape of her neck, come lower on at the base. That's good. Her chin is touching the breast, and when she opens her mouth really wide, see how her chin is touching? There we go. Let go of your thumb. How does that feel?
Good. Very comfortable, actually.
Okay, so it's not hurting, and that's good. And the one thing that I'm looking at here, I'm going to let go of your hand. So I want to look and make sure that this bottom lip is down, the tongue is nice and over that gum ridge, and that's perfect. She's sucking rhythmically. This is a good view of what breastfeeding where the baby is getting lots of milk is happening here. And again, a bath towel might be a little bit better than this that I'm using. But for right now, I'm just going to take it and make it loose. Don't move her head. I'm going to just take this and press this right into the pillow and gather it right up and underneath. And then just drop your shoulder and let her feed. Pauses are normal. And if she pauses more than 8 seconds, then you might want to go ahead and compress your breast, squeeze top and bottom, and then rub her head. See how that gets her going again? So when we compress the breast, and then we rub and stimulate the baby. This is what I call the baby on button right here, or the palm of the hand. So dad, grandma, other family members could just kind of touch the baby a little bit, or the sides of the head. Now you can see nice, long, deep draws, just like that. Good. See? And she has those long bullfrog swallows in the back. When she changes from that to short, choppy, no, rapid pace sucks, she's pausing, quiver sucks, like that. Okay, that means she's not getting any milk. So if we're touching her and she's still doing the quiver sucks, and we've done the breast compression, she's slowing down, her eyes are closed, she's taking deeper breaths, like that, then she's time to remove her. We don't want your nipple to slip forward in her mouth and then for her to suck it back again. So watch for that and think about those feelings. When she's on, she has those nice, deep swallows. Now, this little one has already taken in 2.1 ounces. So we're at the end of her feed, and we can see that her body posture is nice and relaxed. You see that? She's starting to relax. Oops, she says, not so much. And she's going to go ahead and keep feeding a little bit more. She thinks maybe dessert is a good idea today. And then she's going to keep on going. Beautiful. Nicely done, Mia. See that? There we go. Good girl. Good girl. So also let pain be your guide. If it's uncomfortable, then maybe it's just not right. So take her off, redo it again. Okay? Do it over and over until we get it right. Remember, babies have that instinctive need. When they're close, they don't see anything up close. They're very nearsighted, so they act by sense of smell and by sense of touch. So when the nipple is touched under the nose and her chin is touching into the breast, she's going to open and then open again and then lean in. Wait for that second time where she's cueing you, I'm ready, and then you just use the hand right between the shoulder blades to guide her right into the breast. Okay, so open, bam. You know, when she has that nice wide mouth, just gently use this, bring her quickly right up and on there. And then she'll get right on. Your nipple will be right in the center of her mouth. It won't hurt. Now see how she's resting now with her hands to her eyes. And she's just pausing right now. And this is, she's starting to switch into non-nutritive. And she's starting to go to sleep. You can hear her breathing is getting deeper. Hear that? Okay, so she's getting really full. Right, a little snore in here. So she's getting really kind of full. And that's a good signal. Some babies will self-release right off. And others will just, like to hang there and do this. but that's up to you. You know, I would generally have you take her and remove her, burp her on your lap, and switch. We know that she's gotten plenty to eat right now, so it's not as important as when we first start the feed into the feeding.